The arrival of a ChatGPT Health app has some sounding the alarm about the spread of medical misinformation. Well, joining us live is Dr. Michael Bonning, Chair of the Australian Medical Association's Public Health Committee. Doctor, thank you very much for joining us. And we know Dr. Google can cause us a lot of panic. But tell us about this app.
I think the concerns about medical misinformation can be amplified by something like ChatGPT Health. It's a specific instance of ChatGPT focused on health, and it's a response from a commercial entity saying we've got lots of people who put in information about their health. The idea is that it's supposed to be connectable to other parts of your health ecosystem, maybe your watch, maybe your food diary, maybe your step counter, those kinds of things. And that's undeniably useful. There's lots of things that we don't tell the doctor. There's lots of things that it's hard to get across in a 15 or 20-minute appointment. So pre-digesting that data, good. But on the flip side, there is certainly some challenges about, well, does it take into account everything? If you've ever used ChatGPT, as most people have now, it'll give you a slightly different answer if you ask it the same question multiple times.
So, yeah, it's one of those things where I guess we've got to use common sense, but also what are you seeing in terms of the really negative sides?
Some really clear examples have been people being told to change medications or change other things in their life very specifically, causing really severe side effects. The example that is doing the rounds that was really clear and quite horrifying is changing regular salt for a different kind of salt, sodium bromide, which resulted in hallucinations and psychosis. Terrible outcome in that regard. What we also are seeing is the missing of information. So interactions, side effects, not explaining details sufficiently, so that there's not really consent, because that's what we do in the trusting process of delivering healthcare information, is that you've got trust with me, whereas a large language model doesn't have anything with you. It's got some background and some history, and that's about it.
We know that there's a shortage of doctors and the cost of living, so to go to a GP is near impossible. It takes months sometimes and costly. So that is probably going to be an issue as well, because people go, well, I just can't afford it. I mean, we've heard stories before, many people taking more vitamins and think, oh, well, just got to go to the shop and have some vitamins, but it can be really potentially fatal.
I spent a lot of time over the last few years working on the B6 problem, the vitamin B6 problem, and all of the peripheral neuropathy and things that come from overdosing on something that is essentially assumed to be safe. We know that there needs to be guardrails around any kind of health software in everything that we get that might come to you from a doctor, or maybe to manage your blood sugar or anything else like that. It's all approved through the TGA. No approvals here, nothing else like that. So we don't really know what the guardrails are. I don't have any problem with people being health literate and using tools like this to get the most out of a consultation, to bring informed questions, and also to get through that 2 a.m. amnesia. What do I need to talk to the doctor about? What am I trying to do? All of those things are critically important. Attaching it to the other data inputs in your life, your wearables, your grocery list, all these other things, fantastic. But we need to be really clear that this is, we don't count this as being the same as the clinical knowledge input and advice that you can get from a doctor.
We've almost run out of time, Doctor, but what can you put in there? Like, what can you add into the app?
So you can add your medical history. Most people, however, don't have a digital copy of their medical history.
That's what happened in my health records.
And this is exactly right. From the context of hacking as well, I will say this: OpenAI, ChatGPT, data out there on the web. You're putting things up and you're having information brought back to you. On the flip side, your My Health record is layered behind military-grade encryption and security. You're going to do the thing that all hackers want, which is you're going to bring all of that secured data out into the real world. I'd be thoughtful about that. It's the same as if I was suddenly sending my banking password through my email. You know, we keep all our data secured, our money secured in that way. We keep our health information secured as well. I'd be thoughtful and cautious about how I use it, especially with my own data.
Right, Doctor, really interesting indeed. Thank you so much.
Thank you, Janie.